Everything you need to know about the CNA program. Or whether you want to work in a hospital, a nursing home, or in home care, earning your nursing assistant license or credentials is going to help propel you, especially if you're interested in becoming a registered nurse like I am. So hello and welcome. My name is Eunice Mathis. I'm a registered nurse. I actually have a master's degree in nursing education. I'm the owner of Florida Training Academy, and I love training CNAs. I love being that first person who gets to teach you how to provide basic care, who gets to teach you skills and medical terminology. So if you've not yet subscribed to my channel, please go ahead and do so. I also have a personal channel, and that is nurseeunice.com, but I'll make sure that I put those links in the description area. So less about me and more about this CNA process. So what is a CNA? A CNA, or certified nursing assistant, is the person who spends the most time with the patients. So you're providing hands-on skills and hands-on care. You're helping them to brush their teeth. We call these ADLs, or activities of daily living. You're helping them move about the facility. So you're using the walkers and the canes, the gait belts. You're taking the vital signs, and you report abnormal findings to the nurse. So you are the eyes and the ears of the nurse. So when we say that you are the backbone of healthcare, you really are, because without you, there may be 15 patients. We're working hand in hand. I may be getting the medications, talking to the doctors, while you're there holding a person's hand, or maybe helping them if they're sick. Maybe they're vomiting. So you are doing a lot of effective communication, a lot of assisting with the teamwork in order to make sure that these patients remain safe and that they get healthy. In your actual training programs, you'll learn things like how to make an occupied bed, how to perform vital signs, how to take a pulse, what those numbers even mean. We talked about effective communication and working as part of a team, but you'll also learn medical terminology. So this is like a very good first step, especially if you're not sure, what route you want to take in the medical field. So it's good to come in as a CNA, whether you take a quick program or a longer program, and that's going to help you determine whether or not even working with patients, working in a hospital, is the right choice for you. So the training you receive greatly depends upon where you're located. So here I'm in the state of Florida, and the agency that we use is called Prometric, and Prometric does the state CNA exam test for multiple states. If you're in another city or if you're in another state or another country, you could have another testing agency. So that's when I need you to help me help you. What you're going to do is you're just going to go ahead and list that state on Google, and then put behind that CNA testing requirements. And you should find a government site, a state site, that's going to give you the requirements for your CNA test, so that you know what skills are on your test. So I don't want to be teaching you a different skill. Those skills that I'm teaching, the concepts don't change. Aspiration precautions don't change based on state. Making sure your patient has shoes on before you walk them. So it doesn't matter what state or what country you're in, the concepts I'm teaching are basic concepts that's going to help you not only pass your CNA exam, but provide safe patient care. And I don't know how many times I have to say that, safe patient care. At the end of the day, the patients are our priorities, and we are there to serve them. We work to make sure that they stay safe, and if they stay safe, and if you always keep safety in mind, you're going to be a wonderful CNA, and you're also going to be on a great path to start your career as a nurse. You can go to the colleges. You can go to like a community college. Some of them actually have government grants where they will pay for your CNA course. However, you're still going to have some expenses that you have to cover. For example, you'll have to purchase your uniform if the school doesn't provide it. The school should provide you with a textbook, however, and online resources. And we do that in Jacksonville, Florida at Florida Training Academy. So you'll get textbooks, a workbook. You'll have your online resources, but you're responsible for your uniform, your background screening, and the state exam fees. So even me as a registered nurse, I may have paid tens of thousands of dollars to go to nursing school. That does not include my state examination. I have to pay for that out of pocket. So to become a CNA, there may be a small expense. It may be about $300 or $400, but it's worth it. The American Red Cross also in some cities has a CNA program that's free, but it's going to be 120 hours. So pretty much you're going to be working for free for a part of that time, but that's how they actually get the grants, because you're helping the hospital by being there, learning on the job skills, by helping out the staff. But in turn, you attend a longer program because you didn't have the finances to pay out of pocket, but the end result is the same. You pass your CNA examination. Let's cover those expenses again. So you're going to need a uniform. You're going to need to pay for your state examination. Currently in the state of Florida, the CNA exam is $155, and that includes the hands-on skills test and also a multiple choice examination that's administered via computer. And we can talk about the actual breakdown, but because every state can vary, just know that if you're trying to be a CNA, you're going to have to do some skills in front of a nurse, and you're going to have to answer practice questions or test questions on a computer. So you have your testing fees. In order for you to be able to test, you're also going to need to pass a background screening. And that background screening is a level 2. So if you have like a passport or you were recently hired on a job within the last few months, you may be able to use that. But speak to your school, speak to your nursing instructor about whether or not you can use a recent level 2 background screening. If not, anticipate on paying at least $90 for the background screening. So if you were able to attend a free program, you're only looking at about $230 right now between testing and background screenings. I have a link in the description area where you can buy inexpensive uniforms. So your uniform may be $20. You're definitely going to need a stethoscope and a blood pressure kit and an old-fashioned watch with a second hand. You all cannot count anyone's pulse with a digital watch because the screen goes black after a few moments. So it's going to be a sacrifice, but just pay the extra money now so that you will have the equipment you need, and it's going to make you a better caregiver and a safe caregiver. Let's talk about our appearances. You all, minimal makeup. My hair would have to be back, maybe in a ponytail. These patients sometimes can become violent, especially if they're confused, and you don't want to give them anything to pull on. Therefore, you cannot have hanging earrings. You want to have studs or something that's really close to your ear, nothing that the patient can pull on. You would not have on this big bulky jewelry. Look at my fingernails. These are your CNA, your nursing nails. I don't have any acrylic, pretty much it's just fingernail polish, because if you have longer nails or the acrylic, germs can actually grow around on your cuticles, grow under the nails, and now you're taking care of a person who is very sick. And even though you've washed your hands, the germs are still beneath your fingernails because you couldn't clean them properly. So a lot of your facilities are going to require that you have very short professional nails. Tattoos. I have tattoos. Yes, I'm from Florida. We have tattoos, but I don't have tattoos that would be in an area that my medical uniform couldn't, cover them. So you might as well prepare now for nursing school. Even though a job may allow you to show your tattoos, and most of your CNA and your nursing programs, they have these sleeves that are used to cover up any tattoos that are on your arms. If you have tattoos on your neck, you're going to have to get some special makeup to cover it up. It's all about presentation. I know it sucks. They're not letting you be you. Speaking of not letting you be you, natural hair colors. You want to be presentable. You're taking care of an older population who they don't understand why you have green hair and those coffin nails. That's not their concern. If you're trying to take care of somebody and your nails are long, how are you going to make the bed? How are you going to provide private care to the private area with those long nails? Your nails are actually going to poke through the gloves. So again, everything we do is about safe patient care. And when you're entering the realm of the world of working as a CNA, it's about the patient. It's not about you. So I hope I'm drilling that in. So we talked about, your test. You have a hands-on test. You also have a written test. We know what equipment we need. We know how we're supposed to look whenever we go, especially when working in these facilities. We're not going to have our tattoos showing. And we're going to have a wonderful personality, even though the days may be long and hard. If you don't have good shoes, you need to invest in some good shoes, some inserts, with some inserts also, because you're going to be on your feet for 4, 8, or 12 hours, depending on where you're working and how busy that unit is. You're also going to need CPR certification, but it's a different type of CPR certification. We call it basic life support. We offer those courses here in Jacksonville. Normally it's with the American Heart Association. So that course takes about 4 hours to complete. The cost is anywhere from $60 to $80 if your college isn't going to provide that training in-house for you. But that's going to teach you how to take care of somebody who's in cardiac and or respiratory arrest, how to perform those chest compressions, how to use an AED, and also how to work as part of a life-saving team. So if you think about what we see on the TV shows, when on, let's say, the TV show ER, when there's all these people around the hospital bed and everyone has a role, you as a CNA would have a role also. Initially, it just could be chest compressions, but if there's not another CNA there or enough staff there, you could be asked to actually manage the airway by using the bag mask device to give ventilations or breaths to the patients. So that's what you're going to be learning in your basic life support class, which is why it differs from CPR, because you're learning how to work together as part of a healthcare team, not just as an individual. I know this was a quick overview. It was a lot of information, but I'm here to help you. As a matter of fact, I am creating an online course now. We get so many viewers from other countries who want to be a part of Florida Training Academy. However, we can't necessarily get you here to the States because we just don't have the resources. So what we're going to do instead is we have a CNA school, an online academy rather, that we're going to have online. The cost is going to be minimal, but it's going to have multiple modules. In addition to the modules, you're going to see skills videos, and you actually have a discussion forum so that you can chat with the other students. You can also chat with me as your instructor. Best of all, you all, is audio. So yes, you can download your digital book, but I know that some of our students have a harder time understanding some of the terminology, understanding how to pronunciate things. So in addition to being able to read the book, I have actually read out the entire book for you. So the course is in an audio book format and you're going to love it. And I know you all like practice questions, so you best believe that Nurse Eunice provided you with way too many practice questions. We have practice questions on top of practice questions. So again, there's no reason for you to fail the CNA examination. I look forward to working with you. I look forward to being able to call you my colleague one day, my nurse buddy, my CNA buddy. And if I say anything in this video that inspires you, that or that you may have a comment or a question about, just go ahead and again send us a comment. You can put it in the chat area, and as soon as I get an opportunity, I will respond to you. I wish you much luck, much success. Congratulations in advance on earning your CNA certification. Again, this is Nurse Eunice with Florida Training Academy, and I will see you in the next video. Don't forget to like, subscribe, and share. Bye.